हाँ, 1 मिनट आना, जैसे एक छोटा सा काम।
सर आप उसमें शेयर करके देखिए सर, जो
शेयर
तो हम कर रहे हैं, स्लाइड शेयर करके देखिए, नीचे देखिए स्क्रीन शेयर एंड म्यूट।
नहीं, इसको रहने दो। एक तो है ना, मुझे कॉफी ले आना है, तो थोड़ी स्ट्रॉन्ग कॉफी जाएगी अभी। और दूसरा मैडम, ये एक समीर है वीसी, लिख लो एक नंबर, ask him to send a link. शर्मा है, ये बड़ा चक्कर है इनका। ओके, आई विल गिव यू दैट। ये है ना सतीश सर, कुछ फोन करके बोलो कि शेयर द लिंक सो दैट आई कैन बी ऑनलाइन, है ना? ठीक है, उससे बात कर लेना है। ठीक है, एक सेकंड।
नीरज dr.neeraj@dser.org। फॉरवर्ड करता हूँ, बताओ।
Okay, should I share the screen and see?
Sure.
ये है रखना, और एक ग्लास रख दो एक। Should I share the screen and see?
Sure. Please.
Okay, is it okay?
Yes, sir. Yes.
Hello?
Yeah, it's okay.
Hello?
आवाज तो जा रही है, स्लाइड शेयर होगी सर। सब स्टार्ट कर रहे हैं हम। हेलो। हाँ पीयूष, स्टार्ट करें ना? हेलो।
जी बॉस, प्लीज स्टार्ट, यू ऑल आर लाइव। थैंक यू।
ओके, थैंक यू सर। हम वी आर गोइंग टू स्टार्ट।
लिंक आए नहीं ना सर?
हाँ,
लिंक आए नहीं ना?
हाँ,
वो फोन नहीं उठा रहे हैं सर।
ओके। ये मेरे फोन से करना फिर।
उनको बोलिए स्टार्ट कर रहे हैं। वो साहब को नहीं, मैं स्टार्ट कर रहा हूँ।
What is the name? संजय ना क्या? सतीश
के शर्मा।
हेलो। हेलो। मैं नहीं, मैं वो शेयर स्क्रीन किया वो सही आता है?
बिल्कुल बिल्कुल ठीक आ रहा
है ना? तो दैट इज ऑल राइट ना?
है। यस सर।
आई विल बी गोइंग इन दैट फैशन ओनली, राइट?
उसको फुल वो कर दीजिएगा, वो डबल क्लिक करके। ओके ना, परफेक्ट आ रहा है सर।
ये अभी अभी पूरा आ गया?
हाँ,
अभी पूरा स्क्रीन है?
पूरा स्क्रीन तो अभी नहीं दिख रहा, तो पूरा वो उसमें आ गया
अभी?
हाँ यस, परफेक्ट आ गया सर।
नहीं नहीं, पर पूरा स्क्रीन देखने के लिए ये करना होता है। इज इट पूरा आ रहा है अभी?
अब आ रहा है सर।
नहीं, पूरा है ना? देन नोबडी एल्स इज विजिबल, द ओनली
नो नो
स्क्रीन
नो,
इज
यस सर,
विजिबल।
यस सर। नहीं आप भी दिख रहे हैं सर। नहीं हाँ, ये परफेक्ट है, ये परफेक्ट है सर जो अभी।
अच्छा अच्छा, ठीक है, मैंने अभी स्टॉप किया, मैंने अभी। हाँ, ठीक है,
वही सर,
स्टार्ट करें सर?
स्टार्ट करते हैं सर।
ओके, थोड़ी देर में स्टॉप कर देते हैं, ठीक है। ओके,
सभी को मेरा नमस्कार। मुल्तानी फार्मास्यूटिकल लिमिटेड की ओर से
सतीश
कोविड में एक वेबिनार में आप लोगों का स्वागत है। थोड़ा समय मैं आपका दूंगा मुल्तानी फार्मास्यूटिकल लिमिटेड के बारे में थोड़ा इंट्रोडक्शन दे दें और थोड़ा कोविड के बारे में बात कर लें। उसके बाद जो हमारे स्पीकर हैं ऋषि साहब, उनको हम लेके आएंगे, उनको इनवाइट करेंगे। मुल्तानी फार्मास्यूटिकल लिमिटेड 1938 कंसर्न है, एस्टैब्लिश्ड इन लाहौर, and since
योर
1947
वॉइस
we
इज नॉट क्लियर, वी आर नॉट गेटिंग
okay,
योर वॉइस।
आपको सर वहाँ कुछ प्रॉब्लम होगी, आवाज क्लियर है, बाकी लोगों को क्लियर है सर।
आपकी वॉइस नहीं आ रही है तिवारी जी।
जी जी, आप में कहीं कुछ प्रॉब्लम होगी, बाकी में वॉइस क्लियर आ रही है बाकी लोगों में।
मेरे
बाकी बाकी लोगों में क्लियर आ रही है।
ओके, आ रही है। ओके, आई गॉट इट, सॉरी।
Since
Yes.
Multani Pharmaceutical Limited established in 1938 Lahore, and since 1947 after partition we are in Delhi. Now we have two plants, one in Delhi and one in Uttarakhand, and we are manufacturing more than 1,000 products. It is a classical and proprietary. We are in the Ayurveda, Unani and veterinary also. We are in the trade and government supplies also. We have a WHO GMP, that is known as the COPD, Certificate of Pharmaceutical Products, given by CDSCO.
नहीं, अभी नहीं।
And we have a separate ethical division. There is a public drug testing laboratory, and we have more than 500 clients for Ayurveda, cosmetics, modern cosmetics, all these products we are going to test, even 4 products also. And we have a R&D center approved by DSIR, Government of India. So these are the points which Multani have, and we have a Ayush standard mark and PA mark also for our standard production and the plant we have. Secondly, when we are coming to the COVID, because discussion अभी हमारा चलेगा वो COVID पे चलेगा, और at present scenario, life with COVID, इतने महीनों से हम इसको क्या कहेंगे कि झेल रहे हैं, हम ये कहेंगे लोगों को परेशानियां और इन सब चीजों को देखते हुए। तो गवर्नमेंट प्रोटोकॉल की हम बात करें तो डिफरेंट समय पे डिफरेंट प्रोटोकॉल्स गवर्नमेंट की आती रही इन द बिगनिंग, स्टार्टिंग ऑफ मार्च टू अप्रैल 2020 टू अक्टूबर नवंबर 2020। तो अभी क्या है कि जो एक पोस्ट कोविड गवर्नमेंट का एक सर्कुलर आया, उसमें इन्होंने कहा कि हमें जो आयुष क्वाथ, जो मुल्तानी फार्मास्यूटिकल लिमिटेड भी बनाती है, जो डिपार्टमेंट ऑफ आयुष ने सबको दिया, उस फॉर्मुलेशन को किया, और इसमें आयुष क्वाथ का 150 ml 1 कप डेली या दिन में 2 बार आप इसका सेवन करें। दूसरा, समशनी वटी, जो गुरुची घनवटी के नाम से भी आप जानते हैं, इसकी 500 मिलीग्राम की गोली 1 ग्राम पर डे या गिलोय चूर्ण के रूप में आप इसको ले सकते हैं, 1 से 3 ग्राम हल्के गर्म पानी के साथ 15 दिनों तक। उसके बाद हम बात करें अश्वगंधा चूर्ण, जो कि 500 मिलीग्राम दिन में 2 बार गोली के रूप में या 1 ग्राम पर डे के हिसाब से हम अश्वगंधा पाउडर को 1 से 3 ग्राम दिन में 2 बार, या आंवला चूर्ण हमें मिलता हो तो 1 से 3 ग्राम पर डे के हिसाब से हम इसका सेवन कर सकते हैं। इसी क्रम में हम मुल्तानी मुलेठी पाउडर, मधुएस्टी पाउडर जिसको हम कहते हैं, 1 से 3 ग्राम गर्म पानी के साथ इसका सेवन कर सकते हैं। साथ ही में हल्दी का, जो हम कहते हैं कि गोल्डन मिल्क के नाम से आज इसका प्रचार प्रसार हो रहा है, कई कंपनीज ने इसको बनाना शुरू कर दिया, तो 1 कप गर्म पानी में आधा चम्मच हल्दी के मिला के हम उसको सुबह शाम सेवन कर सकते हैं। गार्गलिंग जो है कुल्ला गर्म पानी के साथ, नमक के साथ या हल्दी के साथ हम इसको करें, बेटर होगा। और सबसे बड़ी बात, च्यवनप्राश का जो एक उदाहरण गवर्नमेंट ऑफ इंडिया आयुष डिपार्टमेंट ने हमको दिया कि एक एक चम्मच दिन में 2 बार इसका सेवन करें तो इम्यूनिटी बिल्डअप हमारा होता रहेगा। इसमें बच्चों के लिए भी, बड़ों के लिए भी और बूढ़ों के लिए, जो शुगर पेशेंट्स हैं वो शुगर फ्री च्यवनप्राश का सेवन कर सकते हैं, वो बेटर होगा। साथ में हम जो कुछ मुल्तानी के जो प्रोडक्ट्स हम बना रहे हैं, उसमें इम्यूनिटी बूस्टर टैबलेट, कुका इम्यूनिटी बूस्टर टैबलेट के बारे में जो हम आगे उसका डिटेल में उल्लेख करेंगे उसका। और सेकेंडली गिलोय अर्क, तुलसी गिलोय अर्क के रूप में हमने एक प्रोडक्ट दिया है मार्केट में, जो अच्छा रिजल्ट है फॉर द इम्यूनिटी बूस्टर। इस समय पे हम रसायन और इम्यूनिटी बूस्टर की चर्चा जितनी करेंगे उतना बेहतर होगा, इसलिए कि कोई ट्रीटमेंट है नहीं, और जब तक कोई ट्रीटमेंट नहीं आता तो आयुर्वेद का रसायन एक अच्छा काम करता है, जिसके सेवन से हम स्वस्थ रह सकते हैं। और आयुर्वेद का जो प्रयोजन है स्वास्थ्य से स्वास्थ्य रक्षण, तो हम उस पर फर्स्ट पॉइंट पे हम उसको करें। और जब बीमारी हो तब आतुर्य विकार प्रश्नम की हम बात करेंगे, इन फ्यूचर क्या करना है। पर फर्स्ट पॉइंट स्वास्थ्य से स्वास्थ्य रक्षण का हम उल्लेख हमेशा करते हैं कि जो स्वस्थ व्यक्ति को स्वस्थ रखे, और उसमें रसायन का एक महत्वपूर्ण अंग है। इसी क्रम में हम आगे चलते हुए बाकी जो जनरल प्रोटोकॉल है आयुष के, मास्क क्या है, हैंड सैनिटाइजर का है, मुल्तानी हैंड सैनिटाइजर भी कुका हैंड सैनिटाइजर के रूप में हम हैंड सैनिटाइजर मार्केट में दे रहे हैं विद 70% अल्कोहल, उसका अच्छा रिजल्ट है। और इसी क्रम को आगे बढ़ाते हुए मैं चाहूंगा कि अपने आज के स्पीकर प्रोफेसर रमेश कुमार गोयल जी का मैं यहाँ बुलाना चाहूंगा। थोड़ा ब्रीफ इंट्रोडक्शन मैं उनके बारे में दे दूं। Professor Ramesh Kumar Goyal, the Vice Chancellor of Delhi Pharmaceutical Sciences and Research University, DIPSU, has been the Vice Chancellor for M University of Baroda, Executive Director Research and Strategy at the V Clinbro Labs, Chennai, Director Pharmacology at NMIMS University, Mumbai, Director ISF College of Pharmacy, Moga, Punjab, and Professor of LM College of Pharmacy, Ahmedabad. Recently, he has been given the honorary professor of Strelov State Medical University, Russia, and is the second non-Russian professor being bestowed upon the title in 80 years of the university history. Recently, he has been named among the 2% scientists in the world by the Stanford University study. He has a world rank of 1,652 and 24th rank in India, pharmacology and the pharmacy. There's a great achievement for him. He has over 42 years of experience in teaching and research, particularly in cardiovascular, pharmacology, and diabetes. He is a postdoctoral scholar, visiting scientist, and visiting professor in University of British Columbia, Vancouver, and University of Manitoba, Winnipeg, Canada. Dr. Goyal has 3 patents awarded, 4 under consideration, 21 books, over 350 full papers articles, and book chapters, over 600 abstracts published in national and international journals. He has guided 44 PhD and 185 M Pharma students. He is the recipient of 74 national and international awards. Some of the notable awards include Best Pharmacy Teacher and Best Pharmaceutical Research Scientist Award from APTI, Lifetime Achievement and Distinguished Leadership Award from International Academy of Cardiovascular Sciences, Canada. He has worked on anti-diabetic herbal plants, from preclinical to clinical studies, and identified biomarkers not only for the quality assessment but also as leads for specific targets involved in the prevention and cardiovascular complication associated with the diabetes. He has also been involved in the research related to the personalized medicine and new drug development through 505(b)(2) mode. He also served as the expert member of the Indian Medicinal Plant Review being published by SEIMR, New Delhi. Currently, he is the member of the Scientific Advisory Group of Herbal Division of ICMR, Scientific Advisory Committee of Indian Pharmacopoeia Commission, Faridabad, and Phytopharmaceutical Group of Central Drug Standard Control Organization, that is CDSCO, New Delhi. He has also served as the chairman of many committees, including Endosulfan Committee of Government of Gujarat and Octosulfan Committee of CDSCO. Please, sir, welcome for your brief presentation for our knowledge. Thank you. आवाज नहीं आ रही सर, आवाज नहीं आ रही आपकी।
अभी आ रही है? ओके, नमस्कार। Thank you very much, Tiwari ji, for giving such a elaborated introduction that was not needed. I mean, let me tell the those who are listening to me, I am not in any Ayurved doctor. You can see from the screen also. Neither the doctor nor I will say that I am a person who is a MBBS also. What I am is a simple pharmacologist, a professor, and I am really thankful to the Multani Pharmaceuticals to have given me this opportunity to interact with them and also to give this talk. Also to the Indian Vaidya Association, which it is an honor to me to speak in this platform. Well, we are all going to talk about the corona. We all know, I will not take more time. We all know what has happened from December 2019, कैसे कोरोना ट्रैवल करता हुआ थाईलैंड जापान और यूएस और it started by within a month almost like many countries 50 countries got affected. तब तक शायद कई लोगों ने बहुत सीरियस नहीं लिया था बट आफ्टर मार्च when 100 countries and 150 countries 250 everybody got into it. I used to keep a track of adding of every million. I stopped taking after 25 million. Let me stop it. But as of now, the data which I took yesterday, the whole world, you can see the figure, almost like 5 crores are suffering. And what is happening in India also, we all know. I'm not going to tell how. So we are definitely we are living with Corona, with COVID, and we are having all the sufferings. From time to time, there are the predictions made कि ये अब जीरो पे आ जाएगा, अब जीरो पे आ जाएगा. This was the slide which was there, but things are not. Even in India, still the number of deaths, everything is increasing. Now, what happened? I mean, with respect to tackling the COVID. Now, what has happened is that initially it was considered like a flu type or so. It was just an infection. And what has bothered is the rampant deaths. You, the number of deaths coming up. Number of people infected, this is one thing. But number of deaths occurring, that was a havoc. And then no vector, mosquito or anything, nothing like that. Like plague, you have rats. So nothing of that type. And it is person to person. Then nothing is known even to the modern world about it. That was the problem. What treatment to give, that was also not known. It started that okay, hydroxychloroquine can be given. It was all repurposed drugs. कि एक्सपीरियंस बेस पे जा रहे थे ना. अगर कोई आयुर्वेद में से बोलता है कि हम एक्सपीरियंस बेस पे जाते हैं तो लोग हंसते थे, लेकिन एवरीथिंग फॉर द कोविड स्टार्टेड विद द एक्सपीरियंस बेस्ड ओनली. पुरानी चीजों को समझ से जिसकी कोई आधार नहीं था. आयुर्वेद में तो फिर भी आधार होता है, इसमें कोई आधार के बिना चीजें स्टार्ट हो गई थी. वेल, आई डोंट वांट टू अगेन टेक, बट just to begin with, we all know, you are all, those who are listening, they are all Vaidyas and they are very very learned people, so I need not to tell what are the real clinical manifestations, but these are the lists which have been published by the ICMR. And right from beginning and from time to time some revision, ICMR, our Ayush, everybody has been giving judiciously with all studies, with all evidences, what are the clinical features and all. We all know that like asymptomatic, mild, moderate, severe, and at every stage People may say that, okay, Ayurveda started only with one thing, but the same story was there for the modern medicine also. In the beginning, they were also not knowing. In January and February, nobody was knowing what is this, what to give, how to treat. People were put on ventilators, and later on they realized that no, ventilator is not, just by giving that ventilator is not going to be effective, because it is the internal respiration which is failing. These things continued. Now the situation after 6 months, I mean 3 months, 6 months, 8 months, things have been changing. So now there are clear things that what tests should be done. Even for the test for COVID, there are controversies. There is no test which says that it is 90 plus effective or positive or reliable. That is also there even today. Even the RT-PCR test, which is there, the swab test, is supposed to be 670 to 80% if reliability. I mean, the positivity will be confirmed like that. We all know this. So, managing the patient, slowly we have added based on the experiences coming up. Like in UK, in the United States, in New York, New Jersey, thousands of patients in a day are they are dying. Based on that, studying the post-mortem report, things have started getting published. We realized that it is the brain stroke also which is important. It was realized that it is not only simply lungs, the other things are also getting suffered. How the cardiovascular system is getting affected. All these things started. Now, I am a modern pharmacologist, so I will just tell that few drugs which were repurposed are there. Now, you need not to bother about the all the structures or like that, but typically everybody has been working to find out antiviral drugs. The drugs which were found effective in either HIV or in the swine, the flu which has occurred in the 2000 SARS. I mean, it is the SARS COVID. I will not like to tell that it was a respiratory. The name has come from that only. The episodes have occurred in 2002 and then 2005. The based on those experiences, the antiviral drugs which were partly successful, they were retaken. And of course, today what we have, the remdesivir has come from that only. This was the one of the successful, but again, it is not 100% successful. There are many other things which came in. I will give about the detail, but the story of the modern treatment stands that even remdesivir, if you see this effect, the control versus remdesivir, the marginal difference only. It has been published. There is nothing secret in that. I mean, yes, there is a possibility. Azithromycin, actually, this was the study of the patients in New York, which clearly indicated that if you give drug or you don't give drug, it remains same. But definitely the death rate was less when only azithromycin was given, not in combination with the hydroxychloroquine. And so the things continue. Rather, if you give together, it is worsening. This is again not my report. This is the report from JAMA, which is the most prestigious journal. Dexamethasone somehow emerged as a good drug. Dexamethasone is, and based on that, prednisolone and other. So steroids. Now steroids means immunity. So even today, or rather, this is a story of 1 month that dawa hai hi nahi. This was the statement of the WHO Director General कि अभी तो आई ही नहीं है और अभी तो और सामान्य लगेगा. This is what is there. Now here comes, I come back to that Ayurveda. We all know that our Ayurveda has been the oldest. There are other medicine systems, but what is prevailing is currently the Western medicine, what we are talking. And in my last 5 minutes, I have already tried to discuss. They are there for sure, but you cannot say with confidence that they are the successful. Even today, forget about vaccine, but even for the treatment, there is a struggle. But certainly, the death rate has come down. That is the only rescue that, after understanding, that has come down. Now, see, if I talk about the Ayurveda and the, like, as a pharmacologist, two-thirds of the drugs have come from Ayurveda or the herbal based only. We all know. And the whole era started by isolating various compounds, and slowly various compounds were isolated, and that became the strategy. So in 20th century, when the whole thing started, we always used to talk about the ethnobotany, ethnomedicine, all that, and traditional medicines. There was a stage when nobody used to believe, but now the whole world believes it. Now, I'm going to show only this slide, which clearly indicate that use of complementary and alternate medicine. I mean, this is the slide which shows the uses of this in different countries. This, each dot is a different country, and death per million population. There was a clear negative, I mean, there is correlation that more the use of the complementary medicine, less is the death. This is again, it is a clear data. It is not in any story. The countries like the average usage of complementary medicine, what we say herbal medicines or like that, is 75. The CFR, the death or the fatality ratio was less than 1%. In India and all, it is 1 to 3% as of now. The usage is high. And the countries which use the least, the ratio still remains high. That means that it is the alternate medicine which is going to be the answer. Here comes that yes, we must go for the traditional medicines, but I believe think globally but act locally. On one side, when in January 2020 nothing was known, we started with the Ayurvedic means, various social distancing and all preventive measures, hand sanitizers, all these things are okay. I still remember in Ayurveda, once I was in another country and people were saying, आपके आयुर्वेद में तो वात पित्त और कफ के सिवाय तो कुछ होता ही नहीं है. और उस टाइम पे डायबिटीज की बात थी. I could explain to them what is the Kaph Prameha, Vat Prameha, and Pitta Prameha. And I could correlate from simple obesity to the highest, the neuropathies, all the cardiomyopathy, neuropathy which occurs, that is because of the Vat Prameha. I could tell that. And then I asked them counter question that in your modern thing, you tell me you believe only two. We believe in the three, but you have only two. One is infection, other is immunity. The growth factors and immunity, that's it. You show me anything which goes beyond this. Incidentally, our COVID has both immunity and the infection, both we are talking. Anyway, we are lucky that we have the Ayush Ministry with us, and CCRS is doing that. The guidelines were issued. Yes, the number of cases appear to be high. People say, oh, we are going number 2 in the world in the cases. We feel bad. But if you look in the terms of number of cases per population, per million population, or number of deaths per population, our rank is 90, around 86. I found, I mean, a couple of about 2 weeks ago when I was analyzing that. So probably our role, the what was decided, what guidelines were given in addition to that social distancing has worked. We all know these guidelines. I'm sure those audience, they must be knowing this when you are listening, that the Ayush guidelines, I've just taken one or two things only in that yes, we are classifying at the mild, moderate, and severe like that. And accordingly, the conventional support, conventional treatment, all these things are being given. Conventional treatment of Ayurveda or conventional treatment of the modern medicine, things are being there. But by and large, what we see is that there is a common consensus for last couple of months, almost right from beginning till today, immunity and the rasayana. I have been listening various lectures. Of course, not the hardcore, but I must thank one of the when I listened to Dr. Namrata Joshi, I found that there is a good correlation between the modern and that. So that's why I took two or three of his this slides. I must thank for that I could learn also that COVID and Ayurveda, how so infectious disease affecting the immune system. That's what was the key. And in that, of course, as I told, I am not the hardcore Ayurved person. So Rasayan Chikat. So I tried to understand the Rasayanas a little bit. Certainly, I was very much impressed again that the Am Pachan, that the cell production and all, this is what is happening from the modern science point of view also. And ultimately, various drugs were enlisted by them. And several people, several Vaidyas, several of the scientists, they are giving various drugs. Now, here comes this is the slide which I prepared about 4 months before. That modern medicine, how they are taking it normal, pneumonia, and severe phase, and the drugs which are being given. I have given a little glimpses of that antiviral or hydroxychloroquines or like that. Ayurveda was again the good hygiene, yoga, and one of the thing which came out very popular all throughout the country is the kadha, the decoction, cough, fever, and I mean they are taking care of that kadha probably. And after pneumonia, what? This is what here we started getting our research into it. I will discuss these two posts that how we entered into it. But certainly, these immunoboosters were there, and that's how I also got more interacted with the Multani. I was trying to learn from them that Rasayana, yeah, we are taking care of this Rasayana. That yes, Rasayana therapy has a different clinical, it has its own importance, and various plants called Rasayana. The ashwagandha also, I mean, the trials, everything started. So that drug that acts modulating the neuroimmunosystem. Now, endocrine and immune system. Now, this is the link which is being told in the Ayurveda also. And yes, when we think of Ayurveda, nutrition, digestion, metabolism, circulation, we are talking in a, of course, the languages may differ, but it is there. And a list of actions which are produced. Now, my first attempt was to understand that what has been given by Ayush, the tulsi, cinnamon, ginger, and piper. By the time after 3 months or 4 months, I could understand that virus is definitely there, infection, and it is like HIV virus. If these evidences are there, it is proved that yes, it is going to be effective. But I think by April, everybody knew that it is the angiotensin converting enzyme. It is the renin angiotensin system. Now, renin-angiotensin system, from modern point of view, it is there in the kidney. The AC enzyme is synthesized in liver, and it controls lungs, liver, heart, brain, and even in the eye. It is well known. Now, this is the modern language, but if Ayurveda people say, yes, everything is your amashe to pitta and liver, they are being talked clearly. Only thing, it is the language differs. Yes, it is the renin-angiotensin system, and that renin-angiotensin system with AC affects the immune system. So we started looking that, is there any evidence in that looking to ACE inflammation or immune? Yes, we found, and we used to say that yes, definitely, if decoction is used, it has to be protective, and that's how it is going on. Immune boosters are plenty in the market again, but some of the common constituent which we have found, including those four, Videmnia got from the CCRS, Glycyrrhizia, Edothoda. What you see the green is that there is evidence that it is likely to be effective in the immune, clear cut, in the COVID, definitely. Now, recently we were writing one paper for the Africa. Actually, the statement of that person who was writing about the Africa was, I did not like that sentence. He said that आपके चाइना और इंडिया को एक तरफ रखे और हमारे अफ्रीकन प्लांट्स को एक तरफ रखे तो वी आर डूइंग मच बेटर. See how confident they are, and how confident we try to say that no, we can prevent it. And it happened actually. There was some odd thing which probably they did not know how, they did not do the extensive work, but they claimed it, no, it is correct, and they could control the disease. China also, they have controlled the disease. So where we are lacking, now we are trying to go in a little scientific way and try to do that how can this be there. So based on various properties, we started doing that. See, I am a person trained in the modern medicines and all that, and chemical. We all know that every plant has some chemicals. Today is the time of the computers and all, online everything is going on. So when we started docking the studies, the every plant we used to start, I mean the compounds, and we found that which one is doing better. Actually, in the process we tried to do the modern medicine also, and I wish to share that it was difficult to find any compound which was getting better activity above 8 from the which are having a clear cut AT to angiotensin converting enzyme activity, receptor activity, and viral inhibition activity, and one more ORF. I will come to that, and that all activities at a time we could find in some of the plant material. This was the beginning. We thought that we will have some of the ingredients adjusted according to these activities, and that's what I'm thankful to the Multani that they took our some advice that yes, it can be done and we can plan. We are still in that. Now, as a pharmacologist, I thought, let me discover something new. As a modern person, I have to believe the pathophysiology. So I would like to tell that we started our journey from identification of plant to understanding more pathophysiology, chemicals, phytochemicals, and linking them, and then try to prepare the formulation. We are doing that. We started on the call of our Honorable Lieutenant Governor, the Chancellor also of this university, visit this biodiversity and try to find out. We had a meeting there, identified few plants, We studied first their potentials, why, what led to them. So among them, one of the plant which emerged was the solanum also. Solanum was on the top to produce. Now we tried to correlate that if it is the, we all know the virus, it is the retrovirus. That's why RNA, that virus, that's why we started with that. But if you see the whole cycle, receptor is one part, but once it enters, the multiplication occurs. Okay, the whole world is trying to first control all these things. But what happens in the lungs? It because of the cytokines, oxidative stress, these immune systems which get activated. And all these things are related to angiotensin 2, again, ACE2 enzyme, because it is ACE2 which regulates all the cytokines, proliferation, fibrosis, to everything. There are different pathways. I don't want to bore. It is important to know, but yes, at the molecular level, it is good. And when they found that internal respiration failing was also because of one compound, one target, that was ORF. So we were in search, because Ayurveda principles and the drugs are known for multiple actions. So we wanted to target, can we have it? The slide which I showed now, I mean, a very complicated slide with all the compounds, we wanted to target all the activities at a time. This was the thing. So this was the reason that we all went to this target. I mean, all multiple targets with one or two plants. That's how it is. So even the stroke which is occurring, can we control with that? With the same plant, is it having that activity? We are still in search. And then against that, we try to see that what is the scores. You can see these scores, hardly 4, 5, 6, not much. So we found these compounds. So we are in search of the plants which are likely to be effective, as per the modern people also, better activity. Yes, Solanum nigrum, Euphorbia, and Lenata we found. One of them. They are some of the plant we are working on. As a Rasina, yes, Solanum macoe has come up. Through Ayurveda physicians, when I have given this to many patients, let me tell you, many patients, they were in the moderate to severe condition and they could get the effect. This is what I am trying to say, and I'm feeling happy that I'm sharing this, that yes, we can save more patients if we include even this. I know Ayurveda is not that easy. Like why that there may be person to person variation, but by and large, this is one of them. So we have to think about the inflammation, immune boosters, and all that. But when the patient is entering in the problems, can our Ayurveda really treat it? We are not permitted. I know this many times. Doctors also don't. I had a tough time to fight if I have to. My relative and close friend is in the bad condition. I had tough time to convince, please try. When you don't have any answer, why don't you try this? That's how it is there. We got various chemicals. We are working on it. We are trying to see different targets. So this is the overall story when it comes that when the SARS act on AC2 on one side and immune modulation on other side, producing several effects. Probably if you control that AC2 at different level, you will get the effect, including the ORF, which will prevent the stroke, the ferritin part also. This is what may happen. So in brief, if I summarize, the stages of the diseases, asymptomatic to severity, NIH, USA, or ICMR, they are going in parallel to suggest their drug. Our Ayurveda is also suggesting, and we are successful. Only thing we have to see that we take it to the logistic, something which is internationally acceptable also. And it will be acceptable time, because it's a matter of time now. But my appeal is that yes, keep in mind the hardcore mechanisms which are coming up, and apply these principles of Ayurveda to all this. Then only will come. We are into the phase, we are going to do the work. I am happy to say that we are in the advanced stage. We started our story with the identification of the plants, understanding pathophysiology. My all colleagues were involved in this. And somehow we are now, we hope and we need your all blessings that yes, India will show that we can produce a drug. We are into that formulation. We are trying various plants, bringing them together, and see that it is a direct treatment for the patient, not simply anything like a simple prevention type or so. Maybe you may give in a little milder to moderate to severe patient, and patient will recover fast with full good health. This is what is our target. We are working together. I conclude that yes, the treatment is going to come from herbals only. And when you talk of herbals, Ayurveda will be in the forefront, nothing else. Whether I can bring or my counterparts will bring, my company or the company who are having a trust on me and working, they will bring, I don't know, but it will certainly from India, a drug will come. This is what is my feeling. Tomorrow is the Dhanteras. I know in Dhanteras we remember our God, Dhanvantri. I wish you that Lord Dhanvantri bring happiness. Lord Dhanvantri give all our Vedyas something which we can feel proud and bring across the world that yes, Ayurveda is still do success. With these words, I thank sir. I am done.
Yeah,
Yes,
sir.
sir. Thank you very much for all.
Thanks for your presentation, sir. There is one question regarding research initiative by the pharma fraternity on herbal medicine for COVID.
Yes. So, what is the question?
Question is, what is the research initiative by pharma fraternity on the herbal medicine for COVID?
Okay, see, many pharma companies are doing the work, and again, it is the repurposing. Some of the herbal preparations which were found effective in dengue or other, they have been taken further, and the effects were there. They have tried other things also. There are other work which are being reported scatteredly. I'm talking about the Indian scenario, but in outside also they are doing it. And in fact, I was in touch with the Thailand, Portugal, China. Also, initially they were indirectly connected to me, and they were trying to convey because we were working for the plants. They rather like our approach that we go with the docking to begin with, and we have published the paper also. Research paper has come out, beautiful paper has come out, which talks about this, and they are rather quoting that this is the right approach, and try to see that in the direct cell lines if we can do it, and that's what we are working. We will be coming out soon with the results because it takes little time, but at the same time we are trying to have a formulation based on the Ayurveda combined with the what our understanding is, and but we are trying to understand in this fashion. But as a hard for pharmacology, many people don't believe. That is the main reason that no, they believe in may not trust me also. When I talk doctor that patient will die otherwise, why don't you give it? Don't, many times they don't listen. So this is the question of trust. But I have a trust right from beginning with the Ayurveda also, and even homeopathy I trust. There's nothing like that. But I need to have a scientific basis and principle. That is the only difference which with me.
Okay, thank you. It may be जिन्होंने एक प्रश्न पूछा वो उत्तर से इस आंसर satisfied होंगे. One question is from is the Multani medicine for COVID prevention and treatment. मैं आंसर उसका दे देता हूँ. बेसिकली च्यवनप्राश जो मैंने स्टार्टिंग में आप लोगों को बताया कि च्यवनप्राश मुल्तानी के पास एक कोविड प्रिवेंशन की हम बात करते हैं तो च्यवनप्राश इज देयर. मुल्तानी च्यवनप्राश फॉर शुगर फ्री वी हैव अ च्यवन भोग फॉर शुगर फ्री पेशेंट. तुलसी घनवटी जो संशली वटी के नाम से हम जानते हैं ये भी है हमारे पास. कूका तुलसी गिलोय अर्क अर्क फॉर्म में ड्रॉप्स फॉर्म में ये हमारे पास है. अमृता रिस्ट आसव रिस्ट के फॉर्म में ये हम दे सकते हैं. तो ये सभी चीजों को हम साथ में आयुष क्वाथ की हम बात करते हैं कि आयुष क्वाथ जो डिपार्टमेंट ऑफ आयुष के द्वारा दिया गया फॉर्मूला है उसका प्रयोग कर सकते हैं. और कुका इम्यूनिटी बूस्टर टैबलेट की हम बात हो रही है तो इसका प्रयोग है. इसने उसकी मात्रा डोज के बारे में पूछा है तो 2 टैबलेट्स दो गोली सुबह शाम पानी के साथ खाना खाने के बाद आप ये ले सकते हैं. इट इज फॉर द प्रिवेंशन. वी आर नॉट टॉकिंग अबाउट द क्योर. And secondly, somebody asked from here that why McCoy is selected in juice form. मैं उसमें करेक्शन चाहूंगा कि ये जूस फॉर्म में नहीं है. ऑल द कंटेंट इन कुका इम्यूनिटी बूस्टर टैबलेट इज इन एक्सट्रैक्ट फॉर्म. वी हैव टेकन ऑल इन द एक्सट्रैक्ट फॉर्म. सर यही क्वेश्चंस थे, बाकी और कोई क्वेश्चंस है नहीं. तो मैं चाहता हूं कि जिन लोगों ने सुना और जिन लोगों ने आपके वार्तालाप को आपके प्रेजेंटेशन को देखा सुना वो बहुत ही मतलब ज्ञानवर्धन का हुआ होगा इस विषय पर. हाँ, और सभी का बेनिफिट all will be benefited from this presentation.
I will like to add one thing.
Right, sir.
Like those who are listening, see the difference. How this like Kuka and Multani is going to make a difference is that we are combining now together that base of the modern medicine. I'm not saying we want to add modern medicine, but modern understanding is there. I still remember when I was working in diabetes, somebody showed, when I came back from Canada, I was trying to show something and one of the Ayurveda doctors showed me, sir, it is already there in our Ayurveda, what you are talking. All these new things are there. It is a matter of understanding only. Ayurveda has everything, but how to take it in our own way, that is important. So that's what is going to make the difference in future also.
One more question is there. Any
Yes.
drug interaction between herbal medicine and the modern medicine?
See, now at the time of COVID, when the patient is at the deathbed and all that, the gross interactions are not observed, reported so far. See, drug interactions come after several reports. And if there is anything obvious, here it is not likely, because if we say like our solanum, the compounds which are there, none of those compounds are such that it can interact. I mean, grossly, theoretically, I don't find. But yes, I will not say that no, 100% no interaction. That is also wrong. Only thing, based on the science, we can definitely predict whether it is going to be there or not.
थैंक यू सर. सो इसी प्रश्न उत्तर के साथ हम इसका समापन करते हैं. आपका धन्यवाद एंड डॉक्टर पीयूष जुनेजा फॉर indianvaidy.com. थैंक्स फॉर द कॉपरेशन. धन्यवाद आप सभी लोगों को.
Thank you.